Hello, my name is Todd Wimberly. This is for Nursing 4895. The topic is sickle cell disease, and we will be discussing sickle cell disease. The focused audience, the target audience of this is nursing professionals. Healthy People 2020 lists blood disorders and safety of blood products as one of their primary objectives. Um, The goal is to prevent illness and disability related to blood disorders and blood products. Um, they want people to have a greater understanding of blood disorders, hemoglobinopathies, and one of these hemoglobinopathies in particular is sickle cell disease. Once again, blood safety is a safe and adequate blood safety. A safe and adequate blood supply is vital for health services. Okay, nursing and sickle cell disease. Objectives for this discussion are to increase nursing knowledge of the disease. Nursing Nurses should understand the basic pathophysiology of sickle cell disease. Nurses should understand the populations most affected by sickle cell disease. Nursing care and treatment responsibilities. Uh, we want nurses to understand both acute and long-term management of sickle cell disease, proper nursing attitudes towards sickle cell disease patients will be discussed and hopefully conveyed and received. And nurses as patient educators, we really need to focus on proper patient education. Few sickle cell facts. The prevalence of sickle cell. This is the most common inherited blood disorder in the United States. 70 to 100,000 African Americans are affected by this disease in the United States. Approximately 2 million Americans actually have the trait. Um, 1 out of every 12 African Americans carries the trait, and then we get down to 1 out of every 500 African Americans has sickle cell. It's an autosomal recessive inheritance, which means it has to be inherited from the parents. Each parent must have the trait, and then each child of this pairing of parents has a 25% chance of inheriting sickle cell disease. Um, Longitudinal studies demonstrate life expectancy for adults with sickle cell anemia remains between 38 and 50 years of age, despite improvement in diagnoses and management of the disease. This is really unfortunate, um, that the lifespan of these patients is reduced, and you think about the patients themselves who have these diseases and they're living knowing the fact that their lifespan is reduced. One of the triggers for sickle cell crises can be brought on by stress, and that is a constant stress, knowing that your life expectancy is drastically reduced, 38 years old to 50 years of age at life expectancy. That's a constant source of stress. So we really need to empathize with these patients, and we really need to provide comfort measures, distraction techniques, and just solid patient education. Basic pathophysiology of sickle cell disease. Sickle cell disease is a mutation of the hemoglobin beta gene. It is thought to be a biological adaptation for a malarial defense against malaria. The three main types of sickle cell disease that are seen are your hemoglobin SS, your hemoglobin SC, and your hemoglobin S beta. Hemoglobin SS requires 2 copies of the S gene, and it is the most common. Um, excuse me. Hemoglobin SC is 1 copy of the S and 1 copy of the alpha gene. These are C-shaped uh, cells, and the anemia is described as milder. This is the second most common mutation. And then your hemoglobin S beta is 1 hemoglobin S gene and 1 copy of the beta gene. Lifespans with these three different variations also vary. Your SS has a life expectancy of 45 years of age. Your SC is 65 years of age, and your S beta, your life expectancy is the mid 50s. Um, I guess if you had to choose which mutation you would like to have most, or as a patient, which sickle cell disease they would most like to have, it would have to be the SC. This one is milder anemia, which should lead to fewer transfusions, and the life expectancy is much greater compared to the others. It's almost an average life expectancy, almost 10 years off, but much closer to normal life expectancy than the other forms. Um, Hemoglobin gene mutations lead to shortened lifespan of hemoglobin, which is the primary cause of anemia. So your normal red blood cells are lasting 120 days, and sickle cells are going to last. Your sickle cells are going to last 10 to 20 days. Your mutated red blood cells block smaller passages, which cause vaso-occlusion and sickle cell crisis. Um, which leads to, in fancy talk, you have a prolongation of the erythrocyte microvascular transit time, which basically means vaso-occlusion. Um, length and time it takes the cells to get through microvascular routes. Um, and we will go into this later. Diagnosis of sickle cell, your primary golden standard diagnosis is hemoglobin electrophoresis. Um, which is basically shooting electrical waves through your blood cells, exposing them to the blood cells, and these electrical currents and waves separate different types of cells. So you'll have your normal red blood cells separated from your abnormal, and you can definitively see uh, what you have going on in the makeup of your hemoglobin cells, and doctors are able to diagnose definitively the sickle cell anemia or the sickle cell disease. Your other diagnostic procedure would be blood smear, which is what a picture of is shown right here. You can see your nice spherically shaped erythrocytes, which are regular red blood cells. Those are the healthy ones. They slide as they're supposed to through small microvascular passageways, generally without occluding or causing blockages. And these elongated mutations are your sickle cells, and they even, if you think about round lumens and passageways, these regular erythrocytes, the spherical ones, they just, I guess aerodynamic isn't the word because they're not in air, but I will use it anyway. They look much more aerodynamical. They can slide, they can bend, they're much more moldable, and they're designed to fit through small passageways. Where these big, long, clumsy sickled cells, um, they just kind of bump around and tumble through the passageways. And you can see how this would hit a smaller microvasculature and start clotting, not clotting, but sticking to each other and occluding, infarcting, ischemizing. That's not a word, but I thought it would be cool to say. Complications of sickle cell crisis, sickle cell disease. Your major presentation for your patients are gonna present with vaso-occlusive crisis. They're gonna come in immense pain. Um, Grown muscular men will be buckled to their knees in agonizing pain, crying as if they were small children. It's really a sad sight to see, and but these people are going to present in immense pain. Your microvasculature basically are throughout your body. You have smaller blood vessels everywhere in your body. So this vaso-occlusive crisis can happen anywhere and everywhere in the body. And this vaso-occlusion is going to lead to ischemia and infarction. Um, your other complications are going to be acute chest syndrome. Um, this is very specific to sickle cell disease, and we will get into this a little bit later. Um, Infections are a large problem with sickle cell patients, often resulting from loss of spleen at an early age, um, hand-foot syndrome, which is going to be an enlargement of your hands and feet due to the fact that the blood in these sickle cell patients cannot perfuse, cannot circulate to the extremities like it should. Vision problems, just like diabetic retinopathy, you're going to have vision problems. Think of the small vasculatures in your eyes, and uh, you get the visual occlusion there, and it leads to vision problems. Hepatomegaly, the liver is affected greatly by this sickle cell disease, and you'll see patients presenting with right upper quadrant pain due to the liver issues. Stroke, vaso-occlusion, small vasculature, ischemia, blocked blood passage, blocked blood supply to everywhere, including the brain. So you are going to have um, stroke, possibility of stroke with these sickle cell patients. And priapism is a male-specific complication of sickle cell crisis, and it's also one that many patients are not comfortable discussing. It's hard for some men to say this. They may feel embarrassment, so they may not even tell you that they're having this erection problem. So you, as the nurse, need to ask someone in sickle cell crisis, are you having prolonged erection? Has because these spouts can last anywhere from several hours to much longer, day. I mean, they it can really lead to loss of that portion of their body. They can lose their penis. So we need to ask them about this, and if this is one of the uh, developed complications, it needs to be treated immediately. It is a major issue. Acute chest syndrome. This is, again, specific to sickle cell disease. It is often misdiagnosed as pneumonia or acute respiratory distress syndrome. The prevalence of it is greater in childhood, and acute chest syndrome is more common in sickle cell patients undergoing an operative procedure requiring general anesthesia, and is associated most often with abdominal surgical procedures. So if we have a sickle cell patient who is going under anesthesia and especially getting operated in the abdominal area, we need to be aware of this acute chest syndrome. Signs and symptoms of acute chest syndrome are chest pain, shortness of breath, chills, productive cough, vomiting blood, coughing up blood, hypoxia, infection, and pulmonary hypertension. Um, just you're gonna have your pulmonary blood flow is going to be affected by this sickle cell disease. Um, just like every other part of your body, your your every organ is affected. This disease leaves no organ unscathed. Um, and this acute chest syndrome is actually more of an umbrella term for multitude of complications that arise with sickle cell, um, and not even all of it is understood. And some of the respiratory distress that occurs during this acute chest syndrome is thought to be due to fat emboli breaking off of infarcted bone and throwing in peas into the lung, pulmonary hypertension, just general hypoxia, which is always accompanying your sickle cell crisis. So it's a multitude of things. It's nasty, um, and it can kill them. 25% of people with acute chest syndrome, 25% of patients with acute chest syndrome require mechanical ventilation, and the mortality rate ranges from 6 to 9%. So death is definitely something we're trying to avoid here, and it's definitely a real possibility. Treatment of this acute chest syndrome are going to be antibiotics. You want to think infection first, right off the bat. Antibiotics, um, transfusion, blood transfusion, uh, oxygen. They're in a hypoxic state. They need oxygen, and once again, ventilation. Further treatment. Treatment of sickle cell disease in general is going to be oxygen, fluid, pain management, transfusion, pain management. I said that twice because you're gonna, if you deal with sickle cell patients or will be dealing with, pain management is the number one complaint. They're in They're in so much pain. Um, a lot of your NCLEX style questions or your textbooks will say to start the fluids first. Um, you will have doctors and other studies who say get that oxygen on them first, or it doesn't matter which one, but they need fluid and oxygen now. In my personal opinion, oxygen needs to be started first. Why? Because it's it's you can start oxygen almost instantaneously. Instantly, you can throw oxygen on that person. You hook up the nasal cannula, pump up the 2 liters via the nasal cannula. They're on the oxygen. Then you can work on starting the IV, getting the fluids into them. These sickle cell patients have been poked by needles their entire lives between getting fluids and blood transfusions, and oftentimes they are very very difficult sticks. It's Some of them are almost impossible to get an IV in. Um, you'll even have some that present with ask them, do you have a pick or a port? Some of these guys are getting transfused and so often that they'll actually have a port or a pick, just because they need it, and a lot of them do. So start the oxygen, because one of the main causes of the sickle cell crisis is hypoxia. Um, they're often hypoxic. Get that pulse ox on them, see where they're at. And a lot of times they'll present. You'll have a male in his 20s, and he'll be satin in the 80s or worse, and get that oxygen on him, then get the IV, get those fluids going. But oxygen and fluids are first, um, along with pain management. If they're in that heavy crisis, you're going to go towards opioid. The doctors will often prescribe the opioids, morphine, Dilaudid, whatever they pick. But um, oxygen, fluids, pain management, and then these guys, like I said before, are going to receive blood transfusions their entire lives over and over again. Hydroxyurea is it's a drug that raises the fetal hemoglobin HbF levels in RB in their red blood cells, and it decreases the likelihood of sickle cell formation. Most Many of your sickle cell patients will be on this drug. This is found to It's very helpful in preventing the sickling, which prevents the sickle cell crisis and all the other complications that come along with that. And the only cure for sickle cell crisis or sickle cell disease is bone marrow transplant stem cells. Um, this is often hard to match, and many of them can't. But usually they need a sibling who does not have the sickle cell trait, um, to donate to them, and they have to be compatible. But if they do have a compatible match and the transplant is successful, they can actually be cured of this. So bone marrow transplant is the cure, but it's just not available to many of them out there. Our nursing interventions, you're going to want to have provide comfort measures, distraction, and have enough knowledge to have early recognition. Comfort measures, you got to think the onset of this and during this whole sickle cell crisis, um, stress is a main trigger, and then the crisis comes on and they're under immense pain, so you have more stress, and it can just build on itself and get worse and worse. As a nurse, you need to distract them from that stress. You need to comfort them. um, you need to talk to them while you're doing the process. I'm putting this oxygen on you. You need this oxygen. You're hypoxic. Your oxygen levels are low, and that's making your sickle worse. So I'm putting this oxygen on you. Please breathe through your nose, out through your mouth, in through your nose, out through your mouth. Putting this IV in you. We're going to get these fluids going. This fluid's going to help you. The doctor just orders some pain medication. We're going to get this pain medication in you. Let them know what you're doing while you're doing it. Let them know what you're doing is helping them, calm them. Therapeutic touch, other measures along that line. Relaxation techniques can be employed too. And then early recognition. Recognize you have we discussed who the population, the main population of carriers of this disease is African American. You have a young African American male present to urgent care in immense amounts of pain, um, low oxygen sats. You know, you got to think sickle cell. Recognize it early. If he's saying I'm in pain, I'm in pain. You find his chart. You see he is sickle. You gotta recognize he is in pain. Um, there have been many studies for the attitudes of medical personnel have shown to be very negative towards sickle cell patients, and unfortunately, the attitudes of nurses compared to those of doctors is even shows a higher rate of negativity towards patients with sickle cell. Now, the reason behind this is many of your sickle cell patients are frequent flyers, and many of them are perceived to be pain seekers as well. Um, but that really falls a lot of that falls on nurses as educators and doctors as educators and medical personnel in general as educators. We need to teach them proper pain management techniques so that they do not become habitual pain medicine abusers. Patient education is the key to prevention. So we need to teach our patients about hypoxia. Let them they need to understand that when those oxygen saturation levels drop, that is going to cause the onset of sickling. The red blood cell will sickle with low oxygen rates. Hydration, the same thing. They have to stay hydrated. They have to have your blood cells need adequate hydration in order not to sickle if you have this sickle cell disease. Pain management, which I was just touching on earlier, is a huge area. We need to teach them. You know, opioids are needed in times of crisis. Opioids they are needed when you have the vaso-occlusive crisis, yes, but they shouldn't be your first line if these patients need to learn to adequately measure their pain levels. Um, Hot and cold compress first. If you can do that to relieve the pain, do that. If if that doesn't work, or if you need to do it in combination with NSAIDs or Tylenol, um, then try that. But the opioids really need to be reserved for the big pain events, and they need to be educated to understand that if they do abuse these opioids or if they misuse them and um, always go to the opioid first, they're going to develop that tolerance for it, and then when that real crisis hits, when that real heavy pain really hits, and they need that opioid then and there to relieve the pain or to help manage that pain, um, their tolerance is going to not allow for that. So start with your smaller measures first, your hot and cold compress, your NSAIDs, try Tylenol, and then go to the opioid if needed. And we need to teach them about stress and other triggers, coping mechanisms, relaxation techniques. Um, we need to speak with them about sports, especially your younger kids and your adolescents, your juveniles. Uh, these are regular kids. They want to play outside. They want to be involved in sports. Some sports may be too much for them. Some sports may trigger stress, hypoxia, and if that's the case, then we may need to help them to explore other alternatives. Not saying don't participate in sports or outdoor activities, but maybe there's other sports or outdoor activities that can satisfy that need they have to be outside, um, to compete, to be part of groups of other kids their age or even adults who enjoy sports. Um, but maybe what that particular sport they're playing may not work for them if it's football or soccer or something where they're running a lot and or maybe they just need to learn to manage that sport. They need to definitely speak with their coaches and know their playing time might need to be limited per quarter or per period, depending on what game they're playing. Um, but we really need to teach them stress to avoid stressors and triggers and to adequately manage their sports lives. Um, and that concludes the presentation on sickle cell disease. Once again, this conversation was directed towards nursing professionals. By no means meant to be an comprehensive or all-inclusive, detailed uh, discussion of sickle cell disease, but it was meant to be a broad, um, educational lecture on the main points of sickle, um, and hopefully those who haven't been exposed to patients with it have come away with some good knowledge, and maybe even some curiosity to explore it more. Those who do deal with it on a daily basis. Hopefully this educated you as well in some area. Maybe there was something you were unaware of, or spurred your curiosity to dig deeper into a certain area. But I hope this was worth your time. I appreciate your time for watching this, and thank you very much.